How are ependymoma brain tumors diagnosed? When it comes to diagnosing ependymoma brain tumors, a careful and thorough process is followed. This process begins with a neurological examination by a healthcare professional. During this exam, the doctor will assess various functions, including vision, hearing, balance, coordination, strength, and reflexes. Any abnormalities noted in these areas may suggest the presence of a tumor in the brain or spinal cord. Imaging studies play a crucial role in the diagnosis of ependymomas. The primary imaging tool used is magnetic resonance imaging, commonly known as MRI. This method provides detailed images of the brain and spinal cord, allowing doctors to see the tumor's size, location, and how it relates to surrounding tissues. Sometimes, contrast agents are used during the MRI to enhance the visibility of the tumor. In certain cases, specialized MRI techniques, such as magnetic resonance angiography, may also be utilized. While computed tomography scans or CORT scans can be used, especially to identify calcifications, MRI is generally preferred for its detailed assessment capabilities. Ependymomas can develop in both the brain and spinal cord, so imaging often includes both areas to check for the presence or spread of the tumor. The imaging results typically reveal well-defined masses, which may have cystic components or signs of bleeding. To confirm the diagnosis of ependymoma, a biopsy is essential. This procedure involves obtaining a tissue sample from the tumor, usually during a surgical operation to remove it. The collected tissue is then examined under a microscope to determine the tumor type and grade. In some cases, molecular testing may also be conducted on the tumor cells to gather more information about its characteristics, which can help guide treatment decisions and prognosis. Additionally, cerebrospinal fluid testing may be performed through a lumbar puncture, also known as a spinal tap. This test checks for tumor cells that may have spread into the fluid surrounding the brain and spinal cord. In summary, the diagnosis of ependymoma involves several key steps. First, a neurological examination assesses brain and spinal cord function. Next, MRI is the primary imaging tool, sometimes supplemented by CORT scans. A biopsy confirms the tumor type and grade, and cerebrospinal fluid analysis may be conducted when necessary. This comprehensive approach ensures an accurate diagnosis, which is vital for effective treatment planning. It is important to remember that diagnosis and care should always be handled by specialized medical professionals experienced in neuro-oncology.